there are 33 individual bones that make up the spinal region. 33 individual bones that make up the spinal region. Okay, so we are looking at the image of the spinal region. Remember, I told you earlier on that we have about 33 individual bones that form the spinal region. Okay, so this is the cervical vertebrae, what we call the neck, alright, is the cervical vertebrae. The cervical vertebrae, C1 to C7. These are the disc plates, intervertebral discs that you find there. C1, C2, C3, C4, C5, C6, C7. And our interest is this area, lumbar, which we have L1 to L5, L1, L2, L3, L4, L5. Okay, now if you look at this, this is like a disc, this is 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 a disc. Okay, and you can see this stuff in the middle, it looks like a ball bearing. It looks like a ball bearing. That is what aids the spinal cord to be flexible. That's what aids the spinal column to be flexible. That's what makes it possible for you to bend, for you to twist, and so on. Alright? And that is what we are studying. Remember, the parameter we are looking at is lumbar fiber protruding dimension. Lumbar fiber protruding dimension. Okay, now what you need to know about the lumbar is that the lumbar vertebrae supports. The lumbar vertebrae is what gives the upper part of the body a stable center of gravity. A stable center of gravity while we move. Okay, when you are in motion, it is the lumbar that supports the upper part of the body and makes you not to experience a sense of imbalance. All right, so now let's go back to the first parameter that we are looking at: lumbar fiber protruding dimension. Lumbar fiber protruding dimension. A normal range is supposed to be no direction. A normal range is supposed to be no direction. Okay, so for this particular person's result, the result is no direction. Okay, now this is a parameter that many of us are not familiar with. All right, that's why I'm trying to show us images that will help us see possibilities of abnormal function of the lumbar region. Okay, we are familiar with always seeing no direction, no direction. Okay, so but I'm going to explain to you, when it is abnormal, you are going to see something other than no direction. Okay, so now let's take a closer look at a segment of the lumbar region. Okay, remember we have said that the spinal cord, the spinal column, the spinal region, they are all separated by discs. These are discs. These are intervertebral discs. 1, 2, 3, 4, 5. About 33 of them that we have that sums up to be the spinal region. Okay, and they are all arranged according to this. Now we have something here, okay, which is called the nucleus. All right, it looks like it is positioned like a ball bearing. Okay, if you are familiar with cars, vehicles, and there's what we call the ball bearing. Okay, that is what this looks like. Okay. Now the nucleus allows the vertebral bodies to roll over the incompressible gel. Okay, so this stuff that we're looking like is having a gel-like nature. It has a gel-like nature. All right, now let me say this: the IVD, that's the intervertebral disc, allows the spine to be flexible without exerting so much strength. They also provide a shock absorbing effect within the spine and prevent the vertebrae from grinding together. If you take away this gel-like stuff, these discs will grind together and then they will begin to have issues. You see edges begin to chop off and the pain is not going to be funny. Okay, can you see this image? What you are looking at is a crack, and this liquid, this gel-like liquid, now finds its way to leak out, remember that this is just a protrusion, an extension of this. This is just trying to give us a projected image of what is going on right here. Alright, so look at the blood stuff that we are seeing here, or let's say the symbol of a leakage that has happened here. Can you see that this side of the disc is bigger than this side? You can see that this side is a bit compressed. As it's being compressed, it is touching on the nerve. It's touching on the nerve. Remember that there's a nerve canal here. It's touching on the nerve and it's going to cause pain. Alright, so back to the quantum analyzer results. Lumbar fiber protruding dimension, and a normal range is showing no direction. Alright, what they are trying to say is that if it is held, you are going to see that there is no compression in any direction. There's no compression in any direction, or there's no protrusion in any direction. So that's why a normal range will say no direction. Okay, but usually when there's a compression like this, it is common with the left side. You will see that when there's a disc herniation, the lumbar fiber gel-like nucleus protrudes towards one side of the body. Take note of this. When there is a disc herniation, the lumbar fiber gel-like nucleus protrudes towards one side of the body. The common case is that the left side compresses the equina to the right side. Do you see that? The left side will compress this equina to the right side. So you see that this right side is experiencing a compression. Alright? So in this case, this is not a case of no direction. You can see that there's a compression in the right direction. Okay? So that is what the result of lumbar fiber protruding dimension is talking about. However, when a no direction reading is found, then it is a normal range. It is a normal range. Okay, now let me show you an image of a normal result that will give you no direction. Can you see this image? Remember that we are within L1 to L5, the lumbar region. Okay, so can you see this intervertebral disc? You can see that there is no protrusion. There is no compression anywhere. There is no protrusion anywhere. And so this result in the quantum analyzer will read a no direction. There's no compression here. And so you can see that the nerves are passing without being compressed. And this is the condition of a normal lumbar intervertebral disc. Do you get that? Alright, so that is what we have been trying to establish.
Now can you see the reason why you need to subscribe for this course? The information you can gather from this course goes beyond the operation of the quantum analyzer device. If you are a healthcare consultant or you also use the nonlinear system analyzer device, you will need the widely researched information packaged in this course. So what are you waiting for? Subscribe now. Subscribe now. Subscribe now.
In a situation whereby there is a case of lumbar herniation, okay, that's when there's a leakage of this liquid. That is what causes this guy to get compressed, all right, and that is where we say a disc herniation has taken place, all right. And when that happens, these are the symptoms that you will see in the patient. The patient could experience a low back pain. The patient could experience leg and buttock pain. The patient could experience leg numbness and tingling. Do you get that? So if the lumbar fiber protruding reading are indicating anything other than no direction, then it is out of the normal healthy range. Do you get that? All right. Now let's talk about recommendations. Things that will prevent such from happening. Number one, calcium. Taking calcium regularly will help strengthen the bones and prevent such occurrences. Number 2, physical therapy and strengthening exercise will help strengthen this region of the bone. Okay. Number 3, rest and restriction of physical activity could help correct such conditions. Then, if someone is already experiencing such herniation, injection and analgesics can help reduce the pain, okay, and also prevent swelling. Application of heat or ice to help reduce pain, inflammation, or muscle spasms. Alright, so that's what we have under lumbar fiber protruding dimension.
Now can you see the reason why you need to subscribe for this course? The information you can gather from this course goes beyond the operation of the quantum analyzer device. If you are a healthcare consultant or you also use the nonlinear system analyzer device, you will need the widely researched information packaged in this course. So what are you waiting for? Subscribe now. Subscribe now. Subscribe now.